Hi, hi, Carrie. Welcome to the Retirement Education Center of North America. We're happy to have you today.
Thank you, Mark.
Yeah, so today's topic is going to be PACE, and Carrie Conlon from Harbor Health in the Boston area is here to represent PACE for us. And PACE, for those who don't know it, is a program of all-inclusive care for the elderly, which is our part of our segment on long-term care planning, which is important. So before we get into the PACE, I just have a little housekeeping to do. So first of all, let's talk about there we go. Let's talk about the legal stuff. First of all, we are here, the Retirement Education Center is here to help people understand things and learn things. But we also want to know who's sharing our information. So we give people permission constantly to use our information, but we just want to know. So please reach out to us if you want to. We love sharing. Of course, you can't educate people unless people spread the word. So that's important. But the information we're going to present is broad-based, and everything, if you want to talk to us individually to get a perspective on your own situation, please reach out to us. We're there for you. So that's an important thing for us to know. Okay. What is the Retirement Education Center? Again, we are a place for people to turn to for information and all aspects of financial issues, from high school stuff all the way into long-term care issues that we're going to talk about today. We help people organize their retirement planning. We're just an organization that's there to help people, and we have resources, educational resources, professional resources at our fingertips. Okay, so today's topic is PACE. So, Carrie, tell us, what exactly is PACE?
Sure. So happy to introduce the PACE program. PACE is a national healthcare model that provides care for older adults, 55 years of age and older, that suffer from chronic medical needs. And the goal of PACE is to ensure that our members are safe and healthy at home and in the community setting. So this is a fully integrated provider-based health plan that's servicing some of the most frail members of our society and working as a nursing home alternative. The PACE philosophy is really centered on the belief that it's better for older individuals to be served in the community setting whenever possible.
And I want to add here, the reason why I'm aware of PACE is because I've used PACE. Whenever I talk to people about PACE, I go, what is that? I've never heard of that. That sounds incredible. And my experience with PACE has been incredible. So I just want to say that's the reason why I know of PACE. I was pointed towards PACE when I had someone that I had to manage their care for when they were frail. And it was been a wonderful experience on my end and on the person's end too.
Oh, that's nice to hear.
Yeah, it was great. So, Carrie, we're talking about PACE in the Boston area because we're in Massachusetts, but the Retirement Education Center covers the entire United States. But let's talk about Harbor Health because that's where we are. I just want everybody to know that it is throughout the country. So, tell us, where are you guys located? How does it work?
Sure. So the Harbor Health PACE program is one of 8 PACE programs across Massachusetts. And as you can see in this map, we're covering a pretty large geographic area from Boston all the way down south through southeastern Massachusetts. And we have 2 physical locations, so 2 PACE centers, one in Boston on Morton Street in Mattapan, and a second location on Torrey Street in Brockton. And this map indicates all the cities and towns that the Harbor Health PACE program covers. But again, we're just one of 8 PACE programs in Massachusetts. So you'll find PACE up in Worcester and Springfield, Cambridge, East Boston, Lynn. And PACE is actually in 31 states right now, servicing about 50,000 participants across the country. And 5,000 of those are right here in Massachusetts.
Great. So if I'm watching this webinar, how do I find out where my local PACE is?
So you could always call one of these numbers and we can advise you as to which PACE center is closest to your area. Unfortunately, not every community, Mark, has PACE, so there are uncovered areas where there is no PACE program at this time. But we know this is a model of care that's continuing to grow. We've been here in Massachusetts. The PACE program has been in existence for 30 years. But interestingly enough, it started in the late 70s out in California.
Yeah, and as we go through this webinar, I'm sure people will see this. I've heard of situations where people have actually, I'm talking to a client right now where their long-term care plan, they would actually consider moving into a PACE area to use the program. That's how sweet this program is. People are willing to move because when they get to that point, care is more important than being on the ocean or something. So that's kind of cool.
Yeah.
Okay, so what's this? This is a good, gorgeous looking building.
Yes. So, Mark, this is our center in Brockton at 479 Torrey Street. This is a building that Harbor Health purchased and renovated over 3 years ago. We opened. For those of our viewers that are familiar with the Brockton area, this was a temple that had been at the intersection of Torrey and Pearl Street for many, many years. And it underwent a pretty significant renovation, as you know. And you can see it's bright and it's airy and it's welcoming. And this is our location where all of the medical care takes place. We'll talk more about the offerings of our day program. But yeah, this is a great photo of our location in Brockton.
Yeah, and I actually got involved with PACE before this facility was opened, and we're using the Mattapan facility. And that facility is an incredible place as well.
Yes.
It's on the Milton line, which
Yes.
is wonderful. So, you know, it's a great location. It's easily accessible. And you just right through Milton and you're there. So that's great. And I am familiar with this. I am familiar with this facility. I've been there a couple times for events.
Oh, good. Yes,
Great.
everyone's very impressed when they tour both.
Yeah, you did a great job with this facility. So I know the pictures. We'll get into it because I know pictures show the inside. So let's go there. Oh, yeah, we got a bus. This is cool.
Yes, so people don't have to worry about transportation. PACE has its own transportation that picks people up and brings them right to that PACE center, whether it's in Boston or Brockton. And that's for all their medical appointments, for the Adult Day Health Center. So that's a huge relief for people that, you know, as people get older and they're not driving, transportation, access to transportation can be a challenge. And also we know for families, for caregivers, you know, their loved ones to all their medical appointments can be a challenge. So this is a great feature.
Yeah, so this is interesting, and I want to spend a minute on this. So if I'm at home, I have an elder at home that I'm caring for, and I have to be in my office. The this PACE bus or van will come pick them up, help them out of the house onto the bus. They'll take them to their appointment. Then they'll bring them home.
Yes,
It's a wonderful thing, and I can also accompany them, which is great too, or I can be there, whatever works.
Yeah.
It's a great opportunity for people that have to work, that can't be there all the time, and it fits a nice piece of a problem that I know a lot of people have when they're caring for elders.
Right.
Yeah.
And this can accommodate wheelchairs and walkers, so it makes it nice and easy and accessible for people.
And I know because the person I cared for, they were part of the daycare program. The day center program. So this picked them up at 8, 9 o'clock in the morning and brought them back 4:15 in the afternoon. So it was wonderful. I'm comfortable that, and the bus drivers were awesome. They were just great.
Yeah, it's a great team.
They cared, you know. So anyway, so next one. All right, what do we got here? This is, I know what this is.
The inside.
This is Mattapan. This is the facility.
You recognize this.
Yeah.
The inside of our center in Mattapan. So you can see it looks kind of like a doctor's office with a lovely waiting area where families can be. Like you said, sometimes families want to accompany their loved ones to appointments, and that is always welcomed. This is our clinic area. So at the PACE Center, we have our own medical team of doctors and nurses and dental care and eye care and podiatry and pharmacy. So it's really this one-stop shopping approach. So lots happening right within the center, the PACE Center.
Yeah, that's the part we're going to get into in a couple of minutes. But this is great. You come in, the bus brings your family member in, and you meet them here or whatever, or you take,
Yes.
and then they're seen by their doctor. I'll tell you, the facilities are top notch. They're well kept, and the services are nothing but, from my opinion and my experience, nothing but the best. Whoops, what happened? We just lost something. Here we are. Okay.
And we're back.
All right. Ignore that. All right. So what do we have? This is a social group.
So also within the PACE Center, in addition to all the medical care that's being provided, we have our Adult Day Health Center. So this is, as you can see, pre-COVID. It's a lively space with structured activity that is taking place Monday through Fridays for our participants. So it gets people out. They're having a great time. We have a dedicated activities staff that creates a variety of programming, whether it's computers or entertainment. Here's a group participating in Tai Chi. We do yoga, games, and a whole sort of array of programs. So this just shows the fun that people are having, the social aspect, which we know is so beneficial, especially for this population. It's not required that people come to the day center, but it's encouraged.
Yeah.
The thing is when, as you know from your experience, when people are coming for their medical appointments, instead of sitting around a waiting room all afternoon, they can participate and have a little fun while they're there.
Yeah, and I want to point out that I take a lot of courses on elder planning and elder care, as you do. And socializing is the top concern of a lot of elders. Put yourself in their shoes. Their friends are passing away. Their community is shrinking. So they're always looking to associate with other people. And we're just coming out of this COVID environment. So we've learned that we took for granted socialization on our own level. And but as an elder, they're constantly looking to socialize, and that's the number one concern. And this fills that need, which is phenomenal. And also, I tell people, don't just drop food off to an elder. Spend time and eat with them, or spend some time, because that's what they want.
Connection.
Yeah. So this is wonderful. Perfect. Right.
Yep.
Okay. So what do we have here?
And this is the inside of our center in Brockton. So this is during COVID. So you can see this is a nice big space where people can social distance. Our centers are open and operating for our participants at this time. This, you can see it's a bright room. There's even a fireplace, one on the screen, but also a gas fireplace. And it looks like there's an art program that's taking place. And lots happening at the Brockton Center. And again, plenty of nice open space for people to be there and feel safe.
So these people are picked up at their home.
Correct.
Morning. They're brought in. They're socialized. They have lunch, as we're going to see in a second. And during the course of the day, if they have any ailments, they can talk to their doctor, and their doctor can address them on a daily basis if necessary. Well, I know we're going to get into that next. This is great. So
on a regular basis.
So let's get into that. Okay, so here we are. We've got all our team here. they're all geriatrologists. They're all focused on elders, as opposed to, as we get older, it's no longer a pediatrician or a regular doctor. It becomes a geriatrician. So go ahead, take it away.
Yes. So what's unique about PACE is you have an 11-member team that's assigned to your care. And these clinicians all work together as a team, very cohesive each and every day, and they work right at the PACE center. And as you mentioned, when you join the PACE program, you're assigned to one of our primary care doctors, who is a geriatrician, meaning this is a physician that specializes in elder medicine and those issues and medical issues that affect older adults. And it's almost like this boutique style of medicine, because our doctors are following a very small panel compared to that of a primary care doctor in the community. So I like to say this team is really the heart and soul of the PACE program. They know each and every one of their participants that they're servicing, and they really provide a holistic and preventative approach that's very client-centered. So their focus is on each one of their patients, or we call them participants, and they're treating really the whole patient, addressing medical, behavioral health, social, and wellness needs.
Yeah. So I know my mother's 91, and she doesn't digest food as she used to. So I know the dietitian would be great to get involved, and
Right.
she's got dietitians involved. And with all this pandemic thing going on, she's had to have a social worker call her and help her talk through things, because there's been some disconnection with people. We talk about the social aspects. And then there are times where elders fall and they need physical therapists and occupational therapists and so forth. So this was a great program. So what are the supporting health systems for something like this? I know you're in Brockton and you're in Mattapan. So
Right.
what hospitals do you use?
So we have contracts with different hospitals in the community. We work with the Kearney Hospital in Dorchester. Additionally, we work with Beth Israel Deaconess of Milton. And then in Brockton, we work with Good Samaritans. So we do have contracts with hospitals. But like we can see here, a lot is done. And having a team that's following you so closely and getting to know you, putting in all these preventative measures, actually, our members have far fewer hospitalizations and emergency room visits than those in fee-for-service programs. So, like we say, their care is really coordinated and cohesive and really not falling through the cracks. Think
Wow,
of
that's great.
a team like this that was following you in your medical care on a regular basis. You have a lot of different measures that are put into place to keep you healthy.
Well, that's one of the things we want to do, is we want to keep them out of the hospital.
Right.
So this keeps them out of the hospital, keeps them in an isolated population of their own. And I know what's exciting about this is, I have my PCP and you have yours, but my PCP probably has 1,000 or more patients to care for.
Yes.
How many? I know they have a limited amount of patients.
Right. So they're following like about 125, 150 patients.
Wow.
They don't have practices elsewhere. So they're exclusively at the PACE program. So someone is always on call. This one number that you call if something were to come up and you needed help. So it's 24 hours, 7 days a week. And it's so nice because they're really, like I think we said in the past, sometimes, you visit your doctor and you feel like you're reintroducing yourself every time. But though these doctors really stay with you through the course of your life and really get to know you and all your individual needs. And of course, as your needs change, the program can grow with you.
It almost, and this is the part that when I sat there in my initial meeting with you guys, I said, geez, this is almost too good to be true. How do we pay for all this?
Yes.
So how's that work?
So as we said, this is a national model of healthcare, and it's funded through the offices of Medicare and Medicaid services. And additionally, there is the opportunity to private pay for this program. And I believe we mentioned that in the future, we'll have more of an opportunity to feature a learning series on more specifics of the financial criteria.
Yeah, I think we're going to probably do a second webinar on just that, and that would be great. But I just wanted to get that out there, that it's supported by Medicare and Medicaid services.
Correct. Yes.
This is great, great. So, oh, Heather, yes, nice smiling, bright face. Talk to me about Heather.
Yeah, so Heather's one of our clinical social workers. She's been with the program now for over 8 years. So we have a lot of longevity of staff. I think I mentioned to you, Mark, I've been with the program 15 years myself.
Yeah.
But Heather is just one of the very dedicated clinicians that work with with her team. She has a team of participants, and she's very creative and works to really encourage people to feel supported and independent and safe within their community.
Yeah, well, I know during the pandemic, she must have her hands full.
Yes, yes.
Big thing. Good. Cool. Oh, listen, lunchtime. What's going on here?
Yes, so we do serve a hot lunch at the center. So when people are there, they're served snacks, they have some light breakfast, a hot lunch. So for some people who are no longer cooking or are challenged with food insecurities, they are able to have a nice hot meal prepared for them. And part of our team is a dietitian. So these are meals that are healthy, and they're overseen by our dietary staff.
It's wonderful. So if I have somebody that's is diabetic, they're going to have their or lactose intolerant. They're going to have their lunch designed for their.
Yes, they'll have a meal that's to meet their needs. Yes.
But not only that, I can't tell you how many times I meet with a lot of elders, and I go into independent facilities and assisted living facilities and so forth. And I like to cook. I had a minor in culinary arts, so I make soup.
Oh.
I'll bring them soup and stuff. And a lot of times I'll see in the refrigerator, they don't have a lot of food. And oftentimes I'll say to them, "What'd you have for dinner?" And they had one person said, "Well, I had graham crackers, honey, and peanut butter. I love that with a cup of coffee." It's like, well, okay, nutritionally it might sound okay, but it really isn't. But knowing that I'm going to have someone come to your facility, your community, and they're going to get at least 1 or 2 meals that's going to be healthy, that's very comforting on my part. So that's great.
Yes.
Great job. Okay. What do we have? Rehabilitation services.
So part of the PACE interdisciplinary team includes physical therapy and occupational therapy. So right at the PACE center, people can receive treatments and work alongside a therapist to, assist with strength and balance and help with mobility. There's even the opportunity for some exercise on the new step bike. So lots happening within the rehabilitation department, and helping to eliminate or reduce falls for our participants is always a focus, and get people to where they want to be with regard to mobility and pain.
Yeah, and I just want to point out that this is exactly what I would find in any PT or OT place I went. And it's right there, and it's only for a limited amount of people. It's not like being used constantly for people traffic in and out of a building. This is specific to their needs, and that's it.
Right. So that's a good point. Everyone's care plan is created and designed to their individual needs, and we know that can change. So having a team that can get creative and work with that is huge. And
right, but the traffic is minimal.
Right.
So it's yeah, that's wonderful. Less people touching it, I guess. That's great. All right.
Yes, very specialized.
Tell us about
So,
Alex.
so Alex comes to us with a background in occupational therapy, and he's now working as our center manager. So everything, our staff oversees everything that's going on. The center manager oversees, you know, the day center and the kind of day-to-day operations. And you can see here just a quick interview that he's very passionate about the program and is a true advocate for each participant.
Nice, nice. It's great to see such qualified people that are working with our elders in this program. So anyway, that's excellent. So we have a nice smiling face at the phone, and I've met this woman, and she's a great reception. Right. Great to meet. I love whenever I call, I know who it is, and she's a wonderful
Yes.
person.
Oh, good. Yes.
It's great to see familiar faces. So tell me, we look.
So you can, yes. So we are going to have our information for anyone that's interested to reach out with any specific questions, and we can see if this program may be a good fit. So we'll welcome people to call. I'm always available and work through to see if, you know, if the PACE program and its offerings would meet the needs of those that are potentially interested.
Yeah, and it doesn't fit everyone's situation, but it is there for those that
right.
It does. Yeah.
And that's what we really want this to be, educational. Like I say, working for PACE for a long time, you know, people will say, oh, gee, I wished I had known of this program from my mom or my, you know, my dad. So we want people to know what resources are out there. So when the time comes that people do need help, you know, that they've kind of done their research and they feel like they're making an educated decision with regard to the programs that they're choosing.
Yeah, and this is why we wanted to present PACE, because we are an awareness platform, and we want to make people aware of opportunities like this.
Yes.
Okay, so here's your contact information.
Yes, so I've included both my phone and my direct phone line and my email, and people can also check out our website for additional information.
That's great.
So look forward to hearing from anybody with any questions at any time. And I thank you, Mark, for this opportunity.
No problem. I'm happy to have you guys. And you can also contact the Retirement Education Center too if you need to ask any more questions or you need our help. We would then connect you with Carrie or whomever that you need. And our email address and our phone number there too. So you're welcome to reach out to us as well. So that pretty much wraps it up. Carrie, I want to thank you for joining us and adding to our information pool and helping people become more aware of their options as their elders get older, and we need help too. We're all going to be there someday. So thank you very much.
Oh, thank you, Mark. Always good to talk to you.
Have a great day.
Likewise. Bye now.